How do you interpret an ECG, and what are some common arrhythmias you've encountered?
As a nurse, my approach to interpreting an ECG is a systematic and meticulous process to ensure I don't miss any critical details. I begin by assessing the patient's clinical presentation, as the ECG must always be interpreted within the context of their symptoms. Then, I follow a step-by-step method to analyze the tracing itself. I start by determining the heart rate and assessing the overall rhythm to identify if it's regular or irregular. Next, I measure the PR interval to check for any heart blocks, followed by the QRS complex duration and morphology to assess ventricular conduction. I pay close attention to the ST segment and T waves, as any elevation or depression can indicate myocardial ischemia or injury. Finally, I measure the QT interval to check for any risk of dangerous arrhythmias. This comprehensive approach allows me to quickly identify any abnormalities and connect them to the patient's condition. In my experience, I've encountered a range of arrhythmias that require careful management. Some of the most common ones include atrial fibrillation (AFib), particularly with a rapid ventricular response, which requires a focus on rate or rhythm control and anticoagulation. I'm also very familiar with premature ventricular contractions (PVCs) and premature atrial contractions (PACs), which are often benign but can indicate underlying issues. Additionally, I've managed patients with various degrees of heart blocks, requiring continuous monitoring and, in some cases, preparation for pacemaker insertion. My ability to quickly and accurately interpret these findings allows me to escalate care to the medical team and intervene as needed to ensure patient safety.
Describe a time you had to act quickly in a cardiac emergency.
During a night shift, I was caring for a 65-year-old male patient with a history of heart disease. I was conducting my regular rounds when I noticed a sudden, alarming change in his vital signs. His blood pressure had dropped significantly, his heart rate was spiking to over 140 beats per minute, and he began complaining of severe, crushing chest pain. The monitor showed what looked like ventricular tachycardia, a life-threatening arrhythmia. There was no time to hesitate. I immediately recognized this as a critical cardiac emergency and knew I had to act with speed and precision. My first action was to press the code blue button to alert the rapid response team. While waiting for them to arrive, I calmly but quickly moved the patient to a supine position, administered supplemental oxygen via a non-rebreather mask, and ensured floor access was secure. I had the crash cart ready at the bedside and applied the defibrillator pads, so we'd be prepared for cardioversion if his condition worsened. I kept talking to the patient, reassuring him and keeping him calm while continuously monitoring his vitals and the ECG on the screen. The team arrived within moments, and because I had already completed these crucial first steps, they were able to quickly assess the situation and initiate advanced life support. My ability to remain calm under pressure, make a rapid assessment, and start the initial interventions was key to ensuring the patient received timely and effective care, which ultimately stabilized his condition.
What are the most important medications to be familiar with in a cardiac unit?
In a cardiac unit, a nurse must have a comprehensive and precise understanding of a wide range of medications, as their effects can be immediate and profound. I believe the most critical categories to be familiar with are antiarrhythmics, anticoagulants, vasoactive drips, and beta blockers. This knowledge is essential for patient safety and effective care. First and foremost, antiarrhythmics like amiodarone and lidocaine are vital for managing irregular heart rhythms. Nurses must understand their specific indications, dosing, and potential side effects, such as hypotension or bradycardia, to intervene promptly. Similarly, anticoagulants, including heparin and warfarin, are fundamental. It's crucial to be well-versed in their protocols, monitoring parameters like APTT and INR, and how to manage bleeding risk. A nurse's vigilance with these medications can prevent life-threatening events like strokes or pulmonary embolisms. Next, I consider vasoactive drips to be a core part of cardiac care. Medications such as dobutamine, norepinephrine, or nitroglycerin are used to manage a patient's blood pressure and cardiac output. Their potent nature requires meticulous calculation, frequent titration, and continuous monitoring of the patient's hemodynamic status. A small miscalculation or delay in adjusting the drip rate can have serious consequences. Finally, a thorough knowledge of beta blockers and ACE inhibitors is necessary. These are often standard medications for cardiac patients, and nurses must understand their mechanism of action, patient education points, and how to identify and address side effects like dizziness or fatigue. My familiarity with these medication classes ensures that I can provide safe, effective, and evidence-based care to my patients.
How do you educate a patient on managing a new diagnosis of heart failure?
Educating a patient with a new diagnosis of heart failure is a critical and multifaceted process that requires patience and clarity. My approach is to start with the fundamentals, using plain and simple language to explain what heart failure is and why their body is experiencing these symptoms. I use analogies to help them understand. For instance, I might describe their heart as a muscle that isn't pumping as efficiently as it once did. The first and most important topic I cover is the management of dietary sodium and fluid intake. I emphasize that too much salt and water can put extra strain on their heart, leading to swelling and shortness of breath. I provide them with clear, actionable advice, such as reading food labels, avoiding processed foods, and measuring their daily fluid intake. Beyond diet, I stress the importance of medication adherence. I explain each drug's purpose in a straightforward manner, telling them, for example, that a diuretic helps to remove excess fluid or that a beta blocker helps to slow their heart down. I also teach them to recognize and report any potential side effects. I then empower the patient by teaching them to monitor themselves at home. I show them how to use a scale to check their weight daily and explain that sudden weight gain could signal fluid retention. I make sure they understand which symptoms, like a worsening cough or increasing shortness of breath, require immediate medical attention. My goal is to make the patient feel knowledgeable and confident in managing their condition, transforming them from a passive recipient of care into an active participant in their own health.
Explain the difference between stable and unstable angina.
The primary difference between stable and unstable angina lies in their predictability and the severity of the underlying coronary artery disease. Stable angina is a more predictable form of chest pain or discomfort that occurs when the heart's demand for oxygen increases, typically during physical activity, emotional stress, or exposure to cold weather. The pain is usually brief, lasting for a few minutes, and is consistently relieved by rest or by taking nitroglycerin. It's often a sign of a fixed blockage in a coronary artery that limits blood flow when the heart's workload increases. Essentially, the pain is a warning signal that the heart is working harder than its blood supply can support at that moment. In contrast, unstable angina is a more serious and unpredictable condition that should be treated as a medical emergency. The pain or discomfort is often more severe and can occur without any apparent trigger, even while the patient is at rest or asleep. Unlike stable angina, the pain is not easily relieved by rest or nitroglycerin and may last longer. This condition is caused by a sudden, acute change in a coronary artery, such as the rupture of a plaque, which can lead to a sudden and significant reduction in blood flow. Unstable angina is a strong indicator that the patient is at a high risk for a myocardial infarction or heart attack in the very near future. As a nurse, distinguishing between these two is critical for immediate patient assessment and timely intervention, as unstable angina requires immediate medical attention and potential hospitalization.
What is your experience with cardiac devices like pacemakers or ICDs?
My experience with cardiac devices such as pacemakers and ICDs is extensive and spans from preoperative patient education to postoperative monitoring and troubleshooting. I've cared for numerous patients undergoing initial implantations as well as those receiving device replacements. Before the procedure, I'm responsible for preparing the patient by ensuring they understand the process, addressing any anxieties they may have, and confirming that all necessary pre-op labs and assessments have been completed. This patient education is vital. I explain what the device does, what they can expect during the recovery period, and the lifestyle adjustments they may need to make, such as avoiding certain magnetic fields. Following the procedure, my focus shifts to meticulous post-operative care. I closely monitor the patient's vital signs, ECG for proper device function and rhythm capture, and the surgical site for any signs of bleeding or hematoma formation. I also assess for complications like pneumothorax or lead dislodgement, which requires continuous vigilance and a strong understanding of the ECG changes associated with them. A crucial part of my role is patient teaching for discharge. I provide detailed instructions on incision care, activity restrictions, and signs of infection. I also ensure the patient knows when and how to report symptoms such as dizziness or palpitations. I've also had experience in troubleshooting basic device issues, such as a loss of capture or sensing problems, and can effectively communicate these findings to the cardiology team to ensure the patient receives prompt and accurate device management.
Describe your experience with post-operative care for a patient who has undergone a CABG.
My experience with post-operative care for patients who have undergone a coronary artery bypass graft, CABG, is extensive and has equipped me with the skills to manage the complexities of this critical phase. The immediate period following surgery is a time of intense monitoring and care to ensure the patient remains hemodynamically stable. I'm highly proficient in managing vasoactive drips, continuously monitoring arterial and central venous pressures, and assessing for any signs of bleeding or fluid imbalances. A crucial part of this is the meticulous management of chest tubes, where I carefully monitor the type and amount of drainage and ensure there are no signs of air leaks. I also manage their fluid intake and output with precision to prevent fluid overload, which is a common risk. Beyond the initial stabilization, my care transitions to focusing on pain management and early mobility. Effective pain control is vital, not only for the patient's comfort but also to encourage deep breathing and coughing, which helps prevent respiratory complications like pneumonia. As soon as the patient is medically cleared, I actively assist with progressive ambulation, starting with sitting at the bedside and eventually walking in the halls. I understand that early mobilization is key to promoting circulation, preventing blood clots, and accelerating their overall recovery. Finally, a significant part of my role is patient education. I provide detailed instructions on incision care, medication adherence, and recognizing warning signs to look for at home. By empowering them with this knowledge, I ensure they have a safe and successful transition back to their normal life, promoting long-term health and well-being.
A patient with heart failure gains 3 pounds in one day. What's your first action?
My first action upon discovering that a patient with heart failure has gained 3 pounds in a single day would be to immediately perform a focused and thorough physical assessment. While the weight gain itself is a significant red flag, it's crucial to correlate it with objective clinical signs. I would assess their respiratory status, listening for any new or worsening crackles in the lungs, and check for signs of increased work of breathing. Simultaneously, I would evaluate for peripheral edema in the lower extremities, check for jugular venous distension, and assess the patient's overall skin turgor and capillary refill. I would also review their recent intake and output records, looking for a negative fluid balance. After completing my assessment, my next step would be to promptly notify the physician with a concise and clear SBAR report. I would provide the patient's name, the significant weight gain, my assessment findings such as new crackles or worsening edema, and my recommendation for intervention. My goal is to anticipate the physician's orders and be prepared, so I would have a diuretic, such as furosemide, ready to be administered. I would also continue to closely monitor the patient's vital signs, especially their blood pressure and oxygen saturation, to ensure their condition doesn't deteriorate. This rapid, evidence-based approach ensures that the patient receives timely and appropriate care to prevent further fluid overload and potential respiratory distress.
How do you handle a disagreement with a physician regarding a patient's care plan?
When a disagreement with a physician arises, my first priority is always the patient's safety and well-being. My approach is to handle the situation with professionalism, respect, and a focus on open communication. Rather than engaging in a confrontational debate, I would seek a private moment to discuss my concerns with a physician, away from the patient and other staff. This allows for a more direct and honest conversation without creating tension in a public space. In this discussion, I would use the SBAR format to present my perspective. I would start with the situation by identifying the patient and the specific issue at hand. Next, I would provide the relevant background, including the patient's history and current status. Crucially, I would then share my assessment, explaining my clinical reasoning and the specific concerns I have about the current care plan, supporting my viewpoint with evidence from the patient's condition or current best practices. Finally, I would make a clear recommendation, offering a proposed alternative or a modification to the plan that I believe would be more beneficial or safer for the patient. If after this discussion we still cannot reach an agreement, and I believe the patient's safety is at risk, I would follow my hospital's established chain of command. I would involve my charge nurse or nurse manager to help mediate the situation and find a resolution. My ultimate goal is to advocate for the patient using an evidence-based approach while maintaining a collaborative and respectful professional relationship with the entire healthcare team. I understand that different perspectives are valuable, and a collective approach always leads to the best outcomes.
Tell me about a time you identified a potential risk before it became a problem.
In a critical care setting, vigilance is paramount. I recall a time when I was caring for a patient admitted for a severe cardiovascular issue. Their vital signs were within the normal range, and their symptoms seemed to be under control. However, I noticed a subtle and consistent change in their daily intake and output records. While the numbers weren't alarming on any single day, a trend was emerging. Their urine output was consistently lower than their fluid intake over the past 24 hours. This could easily have been overlooked, as each day's deficit was small, but the cumulative effect was significant. Recognizing this pattern, I performed a more detailed assessment, checking for subtle signs of fluid overload that weren't yet obvious, such as a slight increase in their weight and a change in their lung sounds. I then used SBAR to immediately report this trend to the attending physician. I explained the situation, the patient's status, the background, the consistent negative fluid balance over the last day, my assessment, the risk of fluid overload, and my recommendation, a potential need for a diuretic or fluid restriction adjustment. The physician agreed with my assessment and immediately ordered a dose of a diuretic. My proactive observation prevented a more serious issue, as the patient began to show signs of fluid overload, but my early intervention helped manage it before it led to respiratory distress or a more significant complication. This experience solidified my belief that a nurse's greatest asset is not just reacting to problems, but anticipating them through careful and continuous assessment.
How do you ensure effective communication during a shift change?
Effective communication during a shift change is a cornerstone of patient safety and is a process I take very seriously. My approach is to be both thorough and concise, ensuring that the incoming nurse receives all the critical information without being overwhelmed by unnecessary details. I always use a structured handover method such as SBAR, situation, background, assessment, recommendation, which provides a logical framework for the report. This allows me to clearly and quickly convey the most important aspects of a patient's care. I'll start by outlining the patient's current situation and their diagnosis, then provide a brief background of their admission and a summary of what's happened during my shift. During my report, I focus on the patient's current assessment findings, highlighting any subtle changes in their condition and outlining the ongoing plan of care. I am sure to mention recent lab results, medication changes, and any patient or family concerns. Most importantly, I'll clearly state my recommendation for the next nurse, such as what to monitor closely or what interventions might be needed in the coming hours. I also make it a practice to perform a quick bedside handover whenever possible. This gives the incoming nurse an opportunity to see the patient, and together, we can confirm the patient's identity and equipment settings, fostering a shared understanding of the patient's needs. This process not only improves patient safety, but also builds trust and teamwork among the nursing staff, ensuring a seamless transition of care.
Describe your role as part of a multidisciplinary team.
My role as part of a multidisciplinary team is to be a central point of communication and patient advocacy. A nurse is often the one who spends the most continuous time with a patient, which puts us in a unique position to observe changes in their condition, understand their concerns, and report critical information to the wider team. I see it as my responsibility to ensure that the patient voice is heard and that all members of the team, from the physician and pharmacist to the physiotherapist and dietitian, have a complete and current picture of the patient's status. I'm skilled at using structured communication tools like SBAR to provide concise and accurate updates during rounds or phone calls, ensuring everyone is on the same page. I believe in collaborative problem solving. For example, if a patient is struggling to meet their nutritional goals, I would not only document the issue, but also proactively communicate with a dietitian to explore different food options. If a patient is hesitant to begin physical therapy, I'd speak with a physiotherapist to explain the patient's fears and work with them to develop a more reassuring approach. I also understand the importance of respecting the expertise of each team member. I trust the pharmacist to advise on medication interactions, the social worker to address discharge planning, and the doctor to guide the overall care plan. Ultimately, I view my role as a crucial link that connects all these specialized areas of care, ensuring they function together seamlessly to provide the most holistic and effective treatment for the patient.
How do you communicate difficult news to a patient or their family?
When it comes to communicating difficult news to a patient or their family, my approach is always guided by compassion, honesty, and empathy. I believe it's my duty to be a supportive presence during what is often one of the most challenging moments in their lives. The first thing I do is find a private and quiet space where we can speak without interruption. This shows respect for their privacy and helps them feel more comfortable and secure. I begin by asking a simple, open-ended question like, "What do you already understand about your condition?" This helps me gauge their level of knowledge and allows me to tailor my explanation to what they're ready to hear. I always avoid medical jargon and use clear, straightforward language to explain the situation. I provide the facts directly but with sensitivity, always mindful of their emotional state. I make sure to pause frequently, allowing them time to process the information and ask questions. I'm also very careful about my body language, maintaining a calm and open posture. After I have delivered the news, I transition to focusing on the plan of care and what will happen next. I don't just deliver bad news. I make sure to offer a sense of hope and a clear path forward, whether that involves a new treatment plan, palliative care, or access to support services. My goal is to ensure they feel heard, understood, and supported throughout the entire process, reinforcing that they are not alone.
Why did you choose a career in cardiology nursing?
I was drawn to cardiology nursing because I find the complexity of the cardiovascular system both challenging and fascinating. My initial interest began during my clinical rotations when I saw firsthand the significant impact a nurse can have on a patient's life, from educating them on managing a chronic condition to providing immediate life-saving care during a cardiac emergency. The heart is the body's engine, and I am captivated by the intricate electrical and mechanical processes that keep it running. This intellectual curiosity is a powerful motivator for me to continually expand my knowledge and skills in this specialty. Beyond the clinical aspect, what truly resonates with me is the opportunity to build strong, therapeutic relationships with patients and their families. Many cardiac conditions require long-term management and significant lifestyle changes, which can be overwhelming for patients. I find it deeply rewarding to serve as a patient advocate and educator, empowering them with the knowledge they need to take control of their health. Whether it's teaching someone how to monitor their blood pressure at home, explaining their medications in simple terms, or providing emotional support after a major cardiac event, I feel a sense of purpose in helping them navigate their journey toward a healthier life. This combination of intellectual challenge and compassionate, patient-centered care is why I am so passionate about cardiology nursing. It is a field where I can make a tangible difference every single day.
What are your strengths and weaknesses as a nurse?
My greatest strengths as a nurse are my vigilance and clinical judgment, combined with a genuine commitment to compassionate, patient-centered care. I have a natural ability to remain calm under pressure, which allows me to quickly assess and prioritize in high-stress situations, ensuring that every patient receives prompt and appropriate care. For instance, I'm highly adept at recognizing subtle changes in a patient's condition that might signal a potential problem, enabling me to intervene proactively before a situation escalates. This proactive approach is something I've honed throughout my career. Furthermore, I believe that effective nursing goes beyond just technical skills. It requires strong communication and empathy. I take pride in my ability to build a rapport with my patients and their families, ensuring they feel heard, understood, and involved in their own care plan, which ultimately leads to better outcomes and a more positive experience for everyone. Regarding my weaknesses, one area I've been actively working on is my tendency to take on too much responsibility myself, sometimes finding it difficult to delegate tasks to my team. I have very high standards for my own work and a strong desire to ensure every detail is perfect, but I've learned this can sometimes prevent me from leveraging my colleagues' skills and can lead to unnecessary stress. To address this, I have been making a conscious effort to improve my delegation skills and trust my team more. I now make it a practice to communicate clearly, assign tasks confidently, and follow up efficiently. This has not only helped me manage my workload more effectively, but has also strengthened teamwork in my unit, as it promotes a more collaborative environment where we all support each other for the benefit of our patients.
How do you stay updated on the latest cardiology research?
To stay updated on the latest cardiology research, I believe in a multifaceted approach that combines both formal and informal methods of learning. It's a professional duty to ensure the care I provide is always grounded in the most current evidence and best practices. First and foremost, I make a consistent effort to read professional journals and publications. I subscribe to well-respected journals such as the Journal of the American College of Cardiology, JACC, and the American Heart Association's journals. These publications provide access to peer-reviewed studies and clinical guidelines that are at the forefront of cardiology. Reading these journals allows me to understand new treatment modalities, recent study findings, and emerging technologies that could impact my patients' care. Beyond reading, I actively seek out opportunities for continuing education. I regularly attend webinars, seminars, and hospital-based in-service training sessions that are focused on cardiology. For instance, I recently participated in a course on the latest updates in lipid management and a workshop on advanced ECG interpretation. This type of hands-on learning is invaluable for refining my skills. Finally, I find that collaborative learning is a great way to stay current. I frequently engage in discussions with my colleagues and physicians on the unit about interesting cases or new research they've encountered. This informal exchange of information helps me stay aware of practical applications of new findings in real time. By combining these methods, I ensure that my knowledge base is continuously evolving, allowing me to provide the highest standard of care to my patients.
Where do you see yourself in 5 years?
In 5 years, I see myself as a highly skilled and respected senior nurse on this unit, having fully integrated my knowledge and passion for cardiology into a meaningful contribution to the team. My immediate focus would be on mastering the complexities of this specific unit's patient population and protocols, aiming to become an expert resource for my colleagues. I believe in a philosophy of continuous learning, and I would spend my first couple of years building a solid foundation here, proving my reliability and clinical excellence. Once I've established myself, I envision taking on a leadership role. I'd love the opportunity to become a preceptor, mentoring new nurses and helping them navigate the challenges of the cardiac unit. I find great satisfaction in teaching and helping others grow, and I believe that guiding new team members is a vital way to contribute to a positive and knowledgeable work environment. Furthermore, within 5 years, I plan to have obtained a specific advanced certification, such as the Cardiac Vascular Nursing Certification, CVBC. This would not only validate my specialized knowledge, but also allow me to provide a higher level of evidence-based care to my patients. Ultimately, my 5-year plan is not just about my personal career progression. It's about becoming an invaluable asset to this hospital. I want to be a nurse that my colleagues can rely on and that my patients feel confident in. I am committed to growing with this organization, taking on more responsibility, and contributing to the excellent standard of patient care that you are known for.
How do you manage stress in a high-pressure environment?
To manage stress in a high-pressure environment, I rely on a combination of professional strategies and personal self-care. Clinically, my primary method is prioritization and task management. I mentally triage my patients at the start of every shift, focusing on those with the most critical needs first. I use a structured approach, often a mental checklist, to ensure I'm efficient and organized. This proactive mindset prevents me from feeling overwhelmed when multiple demands arise at once. I'm also not afraid to ask for help from my colleagues. I understand that patient safety is a team effort, and collaboration is key to managing a heavy workload effectively. On a personal level, I believe in the importance of maintaining a healthy work-life balance to sustain my resilience. Outside of work, I make sure to disconnect and recharge. I enjoy running and practicing mindfulness, which are excellent ways for me to decompress and process the day's events. I found that engaging in hobbies and spending time with my family helps me return to work feeling refreshed and focused. I view stress not as a negative, but as a signal that my attention is needed elsewhere. By having these coping mechanisms in place, I ensure that I can consistently perform at my best, even on the most demanding days, while also taking care of my own well-being.
Tell me about a time you were overwhelmed and how you handled it.
During a particularly busy shift in the cardiac unit, I was caring for a patient who was experiencing post-operative complications and required frequent interventions. Simultaneously, a new admission with unstable vital signs arrived, and another patient on my assignment developed a new arrhythmia. The demands of these three critical situations began to feel overwhelming, and I knew I couldn't give each patient the focused attention they needed all at once without a clear plan. My first step was to take a quick 10-second moment to mentally pause and assess. I quickly prioritized the tasks based on patient acuity. The new admission was the most unstable, so I stabilized them with the initial protocol. I then called the charge nurse and, using a concise SBAR report, explained my situation and the needs of my patients. I didn't simply state that I was overwhelmed. I explained the specific tasks that required immediate attention and asked for assistance with a patient who had developed the arrhythmia. The charge nurse immediately assigned another nurse to assist with that patient, which allowed me to focus my full attention on the new admission and my post-operative patient. I also communicated with my other colleagues on the floor. We worked together as a team, with other nurses offering to check on my patients and assist with non-critical tasks. By communicating my needs and collaborating with my team, I was able to manage the workload, ensure patient safety was never compromised, and handle the high-pressure situation effectively.
Why do you want to work at this hospital?
I want to work at this hospital because its reputation for clinical excellence and patient-centered care is truly exemplary, and it aligns perfectly with my professional values. I followed the work of this institution for some time, particularly its leadership in advanced cardiology care, and I am deeply impressed by its commitment to integrating the latest research and innovative technologies into daily practice. This commitment to staying at the forefront of medical science is precisely the kind of environment where I believe I can grow and contribute most effectively. Furthermore, I am drawn to your hospital's strong emphasis on professional development and teamwork. The opportunity to work alongside highly skilled and compassionate colleagues in a setting that values continuous learning is incredibly appealing to me. I understand that this hospital invests in its nurses, offering mentorship and career progression pathways, which demonstrates a clear commitment to staff well-being and long-term retention. I thrive in a collaborative environment where knowledge is shared freely and everyone works together toward the common goal of providing the best possible patient outcomes. I am confident that my skills in critical thinking and patient advocacy, combined with my dedication to professional growth, would make me a valuable asset to your team. I am not just looking for a job. I am seeking a place where I can build a meaningful career and contribute to a legacy of exceptional patient care.